Today we'll discuss about what are the problems that first-time denture wearers can come across. So there are certain problems that you'll encounter in the first week, during the first week, first month, and it can also go up to the first year of your denture wearing experience. So the immediate problem that denture wearers would encounter is pain. So if we come down to this, the dentures are artificial teeth, and they are made of artificial substances. So during the first 1 week to first 1 month, it it is certain that you will feel a little pain or little irritation while you're wearing dentures. This is because this is a foreign material that is being put inside the mouth, so it will take some time for our body to adjust. Some people might see this, some people might not see this, and one of the secondary reasons is if the dentures are too tight. If the dentures are too tight, they are squeezing the mucosa, that is the soft tissue, and because of that, it can again lead to ulcerations, small ulcerations, due to lack of blood supply inside areas. So, which is why we recommend new denture wearers to remove their dentures for every 1 hour or at least 2 hours, and keep them aside for 15 minutes, and massage their gums for 15 minutes, and then again wear it. So giving it some break in 1 hour to 1 hour, that will actually provide it a little more relief, and the body will adapt to the dentures more actively. So, and also these sore spots can be avoided. Second thing is ill fitting or loose. So the reason is that the probably the dentures are not fit to your oral cavity, which is why they will be loose. Depending upon how much loose they are, we can repair them, or we might have to repeat the whole dentures. Uh, and in some cases, in cases where there is severe bone loss, and the bone is not there anymore, in those cases, generally the lower dentures are little loose. But in those cases where there is severe bone loss, and not much of bone area remaining, in those cases the stability of dentures is a little bit tough. In those cases, we would ideally recommend the patient to go for something fixed like implants. And next, coming to next this thing problem is, obviously first time denture wearers will have a problem with speech and certain pronunciations, phonetics. The thing is, when we are wearing dentures, there is an extra layer that our tongue is not used to, the sensation. So the more we speak, we would ask our denture wearers to open up a newspaper, have like an exercise, and read out whatever is there, so that the more you talk, the more the tongue adapts, and more better it your pronunciations get, until your tongue gets used to the new denture that is there, new surface that is there. So this is the problem with speech. And another common problem that denture wearers face is how to bite, how to chew. So so there's a bit of a learning curve here. So first 1 week, we would ask patients to chew something soft, and then progressively increase the hardness of the food, as in softer foods first, and then while you progress, and as you master how you chew with your new dentures, then you can progress on to harder substances like normal roti, and some kind chicky and all. I have come across some patients who have adapted to their dentures so well that they even eat meat like chicken and mutton also. So it all depends upon how you know adapt to your new dentures. And one thing is, while wearing dentures, we can't eat on one side like we are used to with our normal teeth. So for dentures, what we have to do is we have to bite on both the sides and adapt and learn to chew that way. So that is how chewing capability is achieved with dentures. And the next problem that we can see is gum inflammations and jaw paining and everything, jaw pains and everything. So gum inflammations, as like I told you, wearing the dentures continuously for long periods of time, that can irritate your tissue, which can cause to gum ulcerations and everything. And jawbone defect, when if the dentures that are being fabricated for you are little too bulky or too you know uh, too filled, it affects your jawbone, which is why you can have that uh, pain in the jawbone. In such cases, it is better to repeat your dentures